I grew up in Idaho. I'm an Idaho boy. I grew up in Ririe, Idaho. I grew up milking cows and digging potatoes and everything that kind of emphasizes or epitomizes what Idaho is all about. You know, so much of Idaho is about outside, outdoors, you know, whether it be ATVs or mountain climbing or fishing or hunting. You know, that's what people in Idaho love to do, and that requires our hands, requires our arms. And so when they lose that, they lose the things they like to do. About a year ago, me and Dr. Esplin decided that we wanted to create this Center of Excellence on upper extremity. Of course, it's called the Idaho Hand Institute, but we really focus from shoulder to fingertips. We're both fellowship trained orthopedic surgeons, but then did additional training a year after our orthopedic residency in upper extremity. And so we treat all conditions from shoulder to elbow to wrist to fingertips. And we're really the only fellowship trained hand surgeons in this region. So much of orthopedics is about giving function back to patients, or helping patients, empowering them to regain function and get back to what they do with their jobs, their recreations. I mean, we use our hands daily in everything that we do. In fact, we take advantage because we don't even really realize how much we use our hands, our day-to-day things. I personally believe that people are going to get as good of treatment for their upper extremity problems here as they would go into a big university in Utah or even Washington, which many people will travel to the state of Washington to the hand centers up there, thinking that if they travel these long distances, they're going to get better treatment. But the fact is they don't need to travel. They can get just as good a treatment staying local. And that's what we're trying to really emphasize to the public is that we have that, we can offer that here.